Hey guys, welcome to our lecture on hazardous materials. Hazardous materials are all around us all the time. Companies in the United States manufacture more than 50 billion tons of hazardous material every year. Some 400 billion tons of hazardous material are actually shipped throughout the United States by truck, pipeline, railroad, and even tankers. They can exist as a solid, liquid, or a gas. They can irritate, burn, poison, corrode, or asphyxiate someone. So with that, let's get into how we manage hazardous materials in relation to our patients and scenes. Topics that we're going to discuss will include the role of the paramedic, the incident scene size-up, specialized terminology, and contamination and toxicology review. We'll talk about the approaches to decontamination, what protective equipment we need in a hazmat scene, and then how to properly perform medical monitoring and rehabilitation, and the importance of practice. Now, you have learned about some hazardous materials throughout your toxicology and substance abuse lecture, multiple casualty incidents, and then part of the incident management lecture as well. In rescue awareness and operations, we learned about all the other components that go along with dealing with rescue. And so we're going to use a number of these different components as we go through this lesson with the hazardous materials that spill or released as a result of an incident or an equipment failure, human error, or even intentional violation of the law and regulation that governs hazardous materials manufacturing use, and then they're disposable. Let's go ahead and get started. Hazardous materials are shipped throughout the United States by a multitude of ways, by truck, pipeline, railroad, you name it. And so because of that, hazardous material spills can occur in any place, location-wise. We know that hazardous materials is defined as any substance which may pose an unreasonable risk to the health and safety of operating or emergency personnel, the public, and or the environment if not properly controlled during handling, storage, manufacture, and processing, packaging, use, disposal, or transportation. That comes directly from the Department of Transportation. And so we have to be able to recognize that how this actually works in regards to our primary definition. Let's dive into the role of the paramedic. Now, the role of the paramedic is going to play a unique component. We know that hazardous material incidents or hazmat scenes present some of the most challenging situations that you will face as a paramedic. And because of those, as we've mentioned, a hazmat event can involve any kind of substance, including corrosive chemicals, dealing with pulmonary irritants, pesticides, chemical asphyxiants, hydrocarbon solvents, and radioactive wastes. The exposure to hazardous materials may be limited to just a few victims, or it could cause widespread destruction and loss of many lives. However, as the opening case study shown in your textbook, even a small-scale incident is almost always multi-jurisdictional in nature. It's a multi-jurisdiction event. For this reason, EMS agencies should train all of their personnel on how to respond to hazmat incidents and how to interact with other agencies that might be summoned to the scene. These responsibilities include the scene size of the incident, assessing toxicological risk, and evaluating incident management, activating the incident management system. It also has to do with the process for evaluating decontamination methods to treat and transport those patients that were exposed while performing medical care and medical oversight for those at the hazardous material scene. Now, there are some standards we have to be aware of. There's the OSHA publication for CFR 1910-120. This is a hazardous waste operations and emergency response standard from 2004. We also have EPA regulations. The EPA regulations are going to be mirrored by that of the OSHA in order to help protect the environment. We also have NFPA standards, standards for competencies for EMS personnel that are responding to hazardous material incidents. Just like we have with the incident command system, we must make sure that we have a standardized approach for dealing with these large and small size incidents. Now, when we think about the levels of training, you guys are going to be trained at the awareness level, which typically takes about 4 hours, where you can recognize a hazardous material, spill, or scene, and what to do or who to call to help control it. We have EMS level 1, which is the operational level. It's a 24-hour course. It deals with patient care inside the cold zone. And then you have level 2, which is technician level, 40-hour course. And again, this is where you're able to take care of patients in the warm zone. Now, when we think about your incident size up to a hazardous material scene or response, your understanding or process for evaluating the scene really begins prior to your arrival and begins with your dispatch information. We know that as we arrive to the scene, we're going to activate the incident command system and recognize the hazardous situation. The priorities for a hazmat incident are the same as for any other major incident: life safety, incident stabilization, and then property conservation. It's our job to quickly determine if the incident is an open incident or a closed incident, as we discussed in our MCI event. And again, we're going to follow the basics for the incident command system at a hazmat scene. Now, incident awareness. Every emergency site has the potential to be an incident, especially for hazmat. So we want to inspect the scene as far away as we can from a distance, preferably using binoculars to look further on down the line. In this case, we can see a tanker that has some type of placard on it that we would not be able to see otherwise without some type of binoculars or long distance viewing option. Now, as far as transportation, we want to maintain suspicion of the presence of hazardous material at any vehicle accident. Again, we know that there's a lot of ways in which hazardous material is transported. One of the ways that we typically see hazardous material transported is through railroad accidents. In this case, volume of hazardous material can be much larger than that of a truck, and it can involve a number of cars, all of which could be carrying a potentially different type of hazardous material, leading to a very dangerous, uncontrolled-like event. Now, fixed facilities or locations where dangerous substances are produced or stored include things like chemical plants, other facilities in rural areas. Many communities have some kind of fixed pipelines in order to be able to move some of these substances around, especially in your larger manufacturing organizations. Terrorism is always another role that we are concerned about when it comes to hazardous materials. The terrorists may use any variety of chemical, biological, or nuclear device, and in essence develop a weapon of mass destruction. Now, there's a lack of predictability about when or where an attack might take place, but we can have our head on a swivel, paying close attention for potential clues to the scene, looking for things that just don't seem to fit or don't belong in that circumstance. We also have to recognize hazards. These include placard classifications or the absence of a placard, for example. Now, recognizing the absence of a placard does not mean that there's an absence of a hazardous material threat. It just means that it's not properly identified. And so we have to recognize that different locations and different organizations all have regulations that will vary from place to place. Regardless, when you're unsure, treat it as if the material that you're responding to or the scene you're responding to is of hazardous in nature. Now again, the placard cards and classifications, you'll get a chance to watch the ERG guidebook video here in a little bit, but we can recognize some classifications based on the placards. They are diamond shaped. It indicates the hazmat classification based on color code and the hazmat class number. It also is going to have the UN number, which is going to allow for us to recognize the specifics in regards to that hazardous material, and then along with common symbols that you'll see, things like skull and crossbone for poisonous substances, a hand that's a chemical dripping on that's eating it away for acids, things of that nature. Again, other ones we can see are explosives. Here you can see explosives, and then you can see for flammable components as well, that they have those symbols and they have those UN numbers. Again, the hazardous class that you may see on the placard is going to be accorded by a class, hazard type, and then color. You guys can take a look at these in your book on table 5.1. Now, there's several shortcomings to placards. One, quantity may not be sufficient for required placards. They may have some labeling on there, but it may not be enough or may not be visible for you to identify what that hazardous material is. We oftentimes sometimes just see dangerous. Well, that doesn't really indicate what substance is present, and so we're going to have to try to be able to figure out what's going on from other fashions and other objects that we have at our disposal. We need to use the NFPA 704 system. This is a hazardous material classified system. It's used at fixed sites, and again uses a diamond-shaped figures to divide into 4 sections. Red refers to flammability, blue health hazard, yellow reactivity, and white is specific information. And it's going to give you enough information about what's going on that you could hopefully identify potential hazards and identify the material. Now, when we're trying to identify a substance, we're going to use several different components. One primary component is our emergency response guidebook. We also may look for shipping papers inside the cab of the vehicle because that's going to give us all the detailed information that's going on. We also have safety data sheets. They're no longer referred to as material safety, but just safety data sheets, SDSs, and then databases that we may be able to access or have access to from the organization in which is shipping that material. We have Chemtrack and Chemtel. Both are organizations that are designed for dealing with hazardous material spills and can be called for consult. We have our Poison Control Center, toxicologists, and a number of online and applications that we can use at our disposal for references. Now, the ERG guidebook should be carried on every single emergency vehicle, and in this lesson you'll be able to find a link to the latest 2016 ERG guidebook that you can download and save to your mobile device. You can also download multiple apps as well, which are free, that will help you navigate the ERG. It lists more than 1,000 hazardous materials, and they're constantly adding to it with each update. Also, it offers specific emergency procedures, and then shortcomings. It's not a perfect book. There are going to be gaps in areas that make it not so user-friendly, and without practice, it can oftentimes be difficult to find the information you're looking for. I would like to show you the video on the emergency guidebook here, please. So we would normally do a practice in class for this. We'd have you pair up and we'd have you complete the attached worksheet. You'll complete the worksheet and get to watch the remainder of the video in our next segment of the lesson. Shipping papers are the most accurate information about the transported substance. We're looking for the bill of landing. And again, they're required by law to carry those shipping papers with them. It may not be with the driver, but they are in the vehicle. The question is, can you safely get to them or not? For fixed facilities, we're going to be using the data safety sheets. The data safety sheets contains all the data that's on there. They should be posted in a noticeable, easily located position, available for all personnel to be able to read and review at their leisure. We know that there's a number of monitoring and testing devices that we can use to determine the quality and purity of air and gas in the environment. It's going to use a process to determine the percentage of oxygen in the air, and then it also measures the presence of explosive gases, carbon monoxide, and other toxic gases. Litmus paper is another one that's a great way of determining what the pH of a substance is. And then we also have colorimetric tubes, which actually can suck in the air and then search for specific chemicals and looking for some type of reactive agent for us to determine that. Other sources of information, you have lots of things in your textbooks, handbooks, or other technical specialists. Again, there's Cameo, which is going to be a computerized database, which is a computer-aided management of emergency operations. And then other local or regional poison control centers can be a great resource for you. Chemtrack maintains a 24-hour toll-free hotline, 800-424-9300. We also have Chemtrel. Chemtel is going to maintain another one. It's a toll-free emergency response and a communication center. Their number is 800-255-3024. Supplies the names and the states of federal authorities that deal with these radioactive incidents. That's Chemtrel. Chemtrack is a great one for localized spills or content. If it's radioactive, Chemtel is going to be the one that you're most likely going to want to call. We know that there's going to be multiple zones in a hazardous material incident. Your main priority at a hazardous scene incident is safety. Safety for you, safety for those that are around you. Request help right away and establish command if you recognize that it's an emergency hazardous material scene. Evacuate those that you can safely from the incident around you and go from there. We want to make sure that we establish the proper zones for a hazardous material. A hot zone or a red zone is where we're going to see the contamination is actually present. Personnel in that area must wear protective gear, and the number of rescuers is limited to those that are only absolutely necessary. Bystanders are never allowed, probably including you as well as a paramedic. The warm zone, or the yellow zone, or control zone, is the area that's surrounding the contamination zone. It's vital to preventing the spread of the contamination, and personnel must wear appropriate protective gear in that zone as well. And life-saving emergency care generally is performed inside that warm zone, or the control zone. Finally is the cold zone, or the green zone, often referred to as the safe zone. This is where normal triage, stabilization, and treatment are performed. Rescuers must shed contaminated gear before they enter into the cold zone. So they have to be able to go through a decontamination process as they travel through each zone. And again, there should be one preferred method in pathway in and one preferred method out. That's where your ambulance should go, way out of the cold zone. There's no reason for us to be involved in contaminating all of our gear and equipment. Now, there is some specialized terminology that you'll need to be familiar with. These include boiling point, flaming explosives, flash points, ignition temperature, specific gravity, vapor density, vapor pressure, water solubility, alpha radiation, beta radiation, and gamma radiation. You'll be able to reference those through your textbook as well. We know that with contamination and toxicology review, the threshold limit value and time weighted average is one of the other terms you need to be familiar with. There are a number of other components and threshold limits that we need to make sure that you're familiar with. Types of contamination, you have primary, which is a direct contact. Secondary is where a contaminated person or object comes in contact with an uncontaminated person or object. This is the primary method for responder contamination. The patient is not properly decontaminated, or your equipment is not properly decontaminated, and it continues to spread the material with other personnel. Routes of exposure, all routes are fair game. It could be respiratory, topical, injection, or gastrointestinal ingestion. We know that oftentimes the cycles and actions of poisons can play many different roles. We oftentimes have acute effects, delayed effects, maybe localized versus systemic effects. We may see a transformation, biotransformation of the chemical, and synergism, where it's actually going to build off of other chemicals or even medications the patient may be on. Now, treatment for common exposures include a number of things, and a range from supportive care to specific antidotes. Before administering any type of pharmacological treatment, at least 2 sources should agree on the medication that you're giving. It's important to cross-check your antidotes to make sure it's not going to cause a reaction or some type of synergistic effect. Corrosives, we want to try to brush off any dry particles, and if we're dealing with liquids, flush liquid corrosives off with large quantities of water. We would prefer that you use a tincture of green soap that may help with the decontamination, and irrigate the eyes aggressively, especially if there's injuries. We may also want to consider some other type of tetracaine or other type of hydrochloride to assist in the decontamination or irrigating of the eyes. With corrosives, if the corrosive has been ingested, make sure you don't make them vomit. If it burned going in, it's going to burn coming back out. If the patient can swallow and is not drooling, give the person 5 cc's of water per kilogram up to a total of 200 cc's. Remember, the solution to pollution is dilution. And then be aggressive with their airway, breathing, and circulation. For pulmonary irritants, it cannot be decontaminated. We can remove the environment, we can remove a patient from the environment, we can remove the patient's clothing, we can properly decontaminate the exposed skin with copious amounts of water, irrigating the eyes, using tetracaine as a drop to help with any burning or scratching to the eyes or discomfort, and then treat pulmonary edema with their typical components. Things to help with pulmonary edema like CPAP, potentially Lasix, and then things like albuterol as necessary. And then as always, support their ABCs. Pesticides, these are the same things as acetylcholinesterase or ACHE. These are going to be causing these sludge-like symptoms. Sludge is an acronym standing for salivation, lacrimation, urination, diarrhea, or defecation, gastrointestinal distress, and emesis. We also see involuntary muscle contraction and pinpoint pupils. Treatment, again, completely decontaminate them, remove all of their clothing, make sure they've gone through a proper decontamination process, be aggressive in managing and supporting your ABCs, suction as necessary, and suction is going to be important in these guys because they're going to have fluid coming out of every orifice of their body. We want to give atropine. Your textbook says 2 milligrams of atropine until the symptoms have resolved. Typically, it's going to take a lot of atropine, more than you're going to carry in one drug bag. You may have to call for other advanced medications or even have some type of medications delivered to your scene if necessary. If an adult is having a seizure, we're going to go ahead and treat them with either Valium, preferably we would use midazolam or Versed at 2.5 to 5 milligrams IV push. And if the patient has swallowed anything, again, you can give them 5 cc's per kilogram up to 200 milliliters of water, but be very cautious when it comes to administering anything by mouth, as that patient may vomit and then aspirate. There are a number of chemical asphyxiants that we can deal with. The most common chemical asphyxiants include carbon monoxide. We oftentimes don't think of that as a hazardous material, but it is. It has a very high affinity for the hemoglobin and easily displaces the oxygen on the red blood cell. has an affinity of 100 times more than that of oxygen, so it's very hard to get off the hemoglobin once it's on. And then cyanides. They inhibit the ability for oxygen to create adenosine triphosphate that's necessary for muscle energy. Now, general treatment for chemical asphyxiants include decontamination, but that's normally not necessary. We want to make sure we get the individual out of the environment that's toxic and then get their clothing off to help ensure that there's no gas trapped inside of their clothing that may cause more problems or irritants later on. Treatment for CO exposure, the big thing here that we're looking at is going to be to oxygenate the patient. Hypercarbonic therapy is oftentimes necessary, but more often than not, we're finding that we can easily treat these components with high-flow oxygen in the form of CPAP and or using like a portable hyperbaric chamber that you would typically see for like high-altitude pulmonary edema. The goal here is to increase the amount of oxygen and displace the carbon monoxide from the hemoglobin molecule. Treatments for cyanide and other components that we may see, these are going to be the amyl nitrate ampules. They also include sodium nitrate. That's 300 milligrams IV push over 5 minutes. Thiophosphates, 12.5 grams IV push over 5 minutes. And then again, you can repeat those doses as necessary. When you're dealing with the cyanide kit or the hydroxychloroquine, it binds to the cyanide from the oxidized component that's there. It forms carbaminomin, I can't say that, which is vitamin B12, and then it's excreted by the kidneys. Without this, those hydrocarbons are not going to be able to be bound to, and it's not going to allow for them to be excreted out through the kidneys effectively. We also know that with hydrocarbon solvents, we want to make sure that our patient has an airway that's maintained. Again, decontamination. Never induce vomiting in these cases. Patient, again, if they can swallow and they're not drooling, we can consider administration of water and be prepared to treat for seizures with our Versed at 2.5 to 5 milligrams IV. Now, the way in which we decontaminate matters. So let's go over some of the different approaches that we have to decontamination. We know that decontamination is utilized to reduce or remove hazardous materials from people and or equipment. It can be accomplished by physical or chemical means, and it serves several purposes. These include reducing the doses of the material and then reducing the secondary exposure to the patient or any other rescuers. Now, dilution is the first thing that we're going to do generally for decontamination. We're going to apply lots and lots of water to the person, and we may do this in the form of a tincture of green soap to help wash any of those contaminants off. We also know that the runoff from that decontamination needs to be absorbed. We may want to use pads or towels to blot up any of the hazardous material to prevent that from spilling, and commonly these are going to be used during the environmental cleanup. We have neutralization, which is where one substance reduces or eliminates the toxicity of another. Very rare for us ever to use anything like that in EMS. We also have isolation and disposal. This is where we separate the patient or equipment from the hazardous substance. We establish zones, and then the items might be contained or trapped in a hazardous substance should then be removed at a point where it's safe. If it's come in contact or it's been exposed to a hazardous material, most likely there will need to be a destroying or a store of contaminated substances. Now, for decision making, we have to recall the priorities of incident management. Remember, life safety, incident stabilization, and property conservation. Environmental considerations form a major concern only in the case where there is no life threat. Otherwise, life threats will be the first priority that we'll deal with environmental concerns as the most immediate second. We have to use what's called a fast break decision making as far as a mode of operation. We have to have conscious, contaminated victims will often be able to self-rescue. They may try to leave the scene entirely, which is just going to contaminate everything. So we want to try to make sure that people stay in the area they need to be. EMS units must be prepared for gross decontamination, which is a two-step process. You're going to get rinsed and then washed and then do it all again. And then we have to be able to implement that as well. And critical patients and unknown or life-threatening materials may oftentimes be delayed during that implementation process, but it's important that we're thinking along those lines. Now, long-term decision occurs when the patients remain in the hot zone and have not self-rescued. The advantage of this situation is that we know that we can go through a better decontamination, we've got better PPE, less chance of secondary decontamination, and much more concern and easier for us to control in regards to the environment. Now, more detailed research on the actual hazardous material substance is still needed in order for us to determine the long-term effects in regards to the environment or other hazards. Now, field decontamination methods are and types of PPE depend on all the different substances that are involved. When you deal with the unknown, you don't attempt to neutralize it, you just make sure that you protect yourself against any exposure. If it's a dry chemical, try to brush it off and apply large quantities of water with green soap when and if it's available. There is a two-step process as we talk for decontamination. Step 1 is to remove all of the clothing and jewelry that the individual is wearing. Better yet, let them do it. That limits your contact with them. Tell them stay there, strip down everything. Everything from rings to earrings to necklaces to underwear, you name it, it all comes off. Step 2, wash and rinse the patient with soap and water. And then repeat. Lather, rinse, repeat. Pay attention to the difficult areas. I think you're knowing what I mean. The areas where the sun doesn't always shine, needs to make sure those areas are excessively clean as well. Now there's also an 8-step process for decontamination. An 8-step process is we first see where the rescuers enter the decontamination area at the hot end of a corridor and mechanically remove the contaminants. Step 2 is the rescuers drop equipment in a tool drop area and then remove their outer gloves. From there, the decontamination personnel shower and scrub all the victims and rescuers using gross decontamination, and the victims can move directly to step 6 or 7. Now the rescuers are going to need to remove and isolate their SCBAs. We know that they're going to need to remove all protective clothing, including the victims who are still clothed have their clothing removed. And then we go to step 6, which is rescuers remove all personal clothing. The rescuers and victim receive a full body washing, and then they receive rapid assessment and stabilization before transport. You can see that process is much longer. For patients, it's shorter. For us as rescuers or hazardous material personnel, it's going to be a much longer process to ensure your safety. Now, considerations for transport. Field-contaminated patients may still need to undergo a more invasive decon process at the medical facility. Don't be surprised you get there and you think you're all set and clean, and they're going to make you go through a decontamination process. Transport to the facilities that have those capabilities because you oftentimes may need them. We don't want to go ahead and spread the hazardous material throughout the hospital or throughout another health agency. Oftentimes you'll see that there's going to be a stretcher decon pool, a place where they're going to actually put the stretcher, they're going to slide them through, and it will catch all of the contaminated water to help ensure the environment is safe and that there's not a cross-contamination. Protective equipment. There's a number of protective equipment. The one that we think of most often with hazardous materials is a class level A hazmat suit. It's the highest respiratory and splash protection. It is a fully encapsulating suit. It is extremely hot. It is extremely uncomfortable, very difficult to maneuver and even see what you're doing. Level B, these are full respiratory protection, but a non-encapsulating, but it is a chemical resistant type of suit. Level C uses air purifying respirators and non-permeable suits, boots, eye, and hand protection. And then level 3 is our structural firefighting gear. Again, primarily it's not going to provide much protection at all against the provider. Oftentimes it actually may become contaminant because of the absorbing or wicking of any type of hazardous materials by the structural firefighting gear. For medical monitoring and rehabilitation, we want to make sure that the folks are ready to go into a hazmat scene. We must recognize that a hazmat scene can go on for a very long period of time. So we want to make sure that folks are ready to enter. We should be obtaining a full set of vital signs to include blood pressure, pulse, respiratory rate, temperature, body weight, especially for us patients who are going to be losing weight from water weight, ECG, and mental and neurological status. Now the post-exit rehab, again, they need to go through a full decontamination process, and then they need to do a post-entry monitoring. This is where we're going to measure and document the same parameters in the flow sheet as we did with the entrance, but on the exit. Very similar to fire rehab. If they're not of proper health, or they're showing signs of exhaustion or heat exhaustion, we may need to go ahead and stop them from continuing to be part of that rescue. And then remember, these suits cause you to lose excessive amounts of fluid because of the heat that's trapped within them. Fluid replacement is necessary. Gatorade, water, and then IV fluids or electrolytes may be helpful. Again, we talked about the heat stress factors, things to take into account: outside temperature and humidity, poor hydration status, duration and the degree of activity that they're doing inside of these hazardous suits, and then the level, again, of the protection suit that they're using. We know that practice makes perfect. In order for us to have perfect practice, we need to make sure that we're going to perform like we would in the field. So put on and take off a level B hazmat protective equipment. Set up and take down and practice decon, the 2-step or the fast break or the 8-step process, the long term. Identify a simulated chemical, determine the correct PPE, establish the proper decontamination methods, the monitoring methods and the flow sheets, implement the incident command system. All of these things will help you practice for when you have an actual live event. In summary, we've talked about the role of the paramedic, the incident size-up, specialized terminology, contamination and toxicological review. Make sure that, again, you're going back to your textbook to review that specialized terminology. And then the hazardous material protective equipment, medical monitoring, rehab, and importance of practice. Remember that your safety is at the forefront of everything that you're going to do. And if you don't have the proper training or proper protective equipment, make sure that you're staying back at a safe distance. The best thing for you to do is to remain uphill, upwind, upstream from any type of hazardous material. Use binoculars to look for placards and identification methods, and make sure that you're familiar with the use of the ERG guidebook. Hopefully this has been helpful, and we'll catch you guys in the next lesson.